whitening. So a lot of patients will come and they will ask for brighter teeth. So we have to create a result that looks a bit brighter and a little bit whiter, but also at the same time we might want to deliver a natural result. So we have to try to create a result that has both elements, still looking real, but still looking whiter and brighter. And at the same time, we may not want to treat upper and lower for many reasons. We may just need to deliver a result on one arch. So then we have the challenge of matching the upper with the lower. So color is, and you'll see a previous video on my page about color, it is so complicated. It's not just like choosing a paint color. It's all down to thickness, it's all down to what's behind the veneer on the natural tooth, it's all down to the thickness of the enamel on the real tooth. Maybe there's defects in the way the tooth has been developed. There's a lot involved in color. So this case is a perfect example of the challenges of trying to resolve a discolored smile. The issues we have here is we have a body color of the tooth, which is yellow, because we have thinned out the natural enamel over time through acid erosion and wear and tear. We also might have some developmental issues where the enamel has been developed irregularly, which is the outer surface of the tooth, and that irregular enamel development has meant that we have some show through, and sometimes it could be antibiotics, it could be things like that when the patient's teeth were developing as a child. So I have to now try to deliver a veneer result here because we have shape issues, we have worn down issues, we have quite a lot of things to deal with. And we have a midline that's what we call canted, so off to one side. So you see the whole smile is out of proportion with the face, out of balance. But I have to do that minimally. Now, I could do it non-minimally and I could drill off a lot of the natural tooth and I could create a very thick veneer to block out all of this darkness. But as we all know, I don't like doing that. I like to try and keep my patient's teeth underneath really, really healthy and strong and without reducing. So the first step, actually, and it might be strange if we're going to be covering the tooth, is to actually whiten the teeth. So we put the patient into a whitening program for a little bit of time at home. It's the best way of whitening teeth. And we did this for a few weeks. And what we'll see here is the body of the tooth has actually started to become a little bit brighter. But what we have is patches where there's not enough enamel to whiten, has not actually achieved that. So up here, we still have some darkening. So now, why have I done this? Because now I can actually go thinner on my veneer, meaning less preparation on the tooth to block out that color. So I'll have the whiteness of the tooth shining through and the yellowness bringing in some warmth. So I'll be able to actually deliver something that's natural, but still brighter. And you know, tooth whitening is always something we recommend before we place a veneer because it will, for this reason, it will shine through better and I can go more minimal in my dentistry. So the final result was always done after temporaries, but what you'll see is that the upper and lower, we've gone a little whiter on the upper than the lower, but it's not so noticeable because of the positioning of the teeth. We've balanced out the irregular smile, so we brought that straight down. We now have a color that looks correct for the skin tone and the lips, but we still have a warmth shining through where we can actually see that real effect of the tooth without losing any of the character, and everything's still a little bit brighter. So if we're ever wondering why do I recommend whitening before a veneer if we're going to cover it anyway, it's so that we can still be minimal and we can still create something natural. And again, it's about understanding the material and how best to use it.